This video does not condone the use of performance enhancement drugs, and the information provided here is solely for educational purposes only. Hey everyone, it's me again, Larry. In this video, I'll be giving you all the information you need on Triptorelin. I'll provide you with the most important pieces of information in this video, so stay tuned. Triptorelin, sold under the brand names Decapeptyl and Gonapeptyl, among others, is a medication that acts as an agonist analog of gonadotropin-releasing hormone, thus reversibly repressing expression of luteinizing hormone, LH, and follicle-stimulating hormone, FSH. Triptorelin, GnRH, gonadotropin-releasing hormone, is being used during PCT, post-cycle therapy, for users' recovery or restarting their normal testosterone production. GnRH has been used for a long time by horse breeders as a way to stimulate the anterior pituitary to release follicle-stimulating hormone, FSH. FSH plays the main role in stimulating the production and maturation of germ cells, which either become sperm in males or eggs in females. This means when your pituitary is stimulated to produce FSH as a reaction from GnRH, FSH will begin to stimulate the production of sperm in men. GnRH pulses in our bodies, and that pulse controls when we produce FSH. The dosing of Triptorelin is very important. We can't stress this enough. Triptorelin makes a great jumpstart because, unlike HCG, it stimulates both LH and FSH to a higher extent and has a much more lasting effect. But much like HCG, we need to be very careful with our pituitary gland and avoid hyperstimulation. We need to pulse it once at a small dose, stimulating the pulse that is normally sent from our brain, and then let our bodies do the rest of the work. One single 100 microgram dose per cycle, after all esters have cleared the body, is enough to jumpstart testosterone production again. Triptorelin is so powerful that large doses, around 5 milligrams, 4,000 micrograms, repeated once a month are being used as a chemical form of castration. This dose is so intense on the pituitary gland that it hyperstimulates, resulting in castration-like levels of testosterone serum in the body. Much like HCG, dosing is delicate, and too much is not a good thing. We need to use Triptorelin as a restart, one and done, and not overdo things because it may have a much more opposite and negative effect. So, I have just enlightened you with the benefits that go with using Triptorelin. It's now time for us to go over a few of the side effects that you will need to be aware of before you consider using this peptide. Triptorelin can cause a temporary increase in certain hormones. Contact your doctor at once if you have painful or difficult urination, burning when you urinate, blood in the urine, bone pain, increased urination, hunger, dry mouth, fruity breath odor, or nerve problems, back pain, muscle weakness, problems with balance or coordination, severe numbness or tingling in your legs or feet, loss of bladder or bowel control. We should associate post-cycle therapy when we run this drug dose at medically used levels. Triptorelin overstimulates the pituitary. The initial result is increased or even extremely high production of luteinizing hormone. The chronic result is shutdown and essentially no production of LH. There's been a theory that a single injection of Triptorelin 100 micrograms might be used to recover testosterone production where it has been chronically suppressed, without triggering shutdown. It does seem highly likely to me that there's probably no risk of triggering shutdown with this approach, and likely that it could provide a brief stimulus to the pituitary. Triptorelin is used when your body completely shuts off and doesn't respond to any other PCT, such as HCG or Clomid. That's when you want to jumpstart your body with one dose of Triptorelin. That's all, everyone. This has been your friend Larry. Consult with a health professional on a regular basis before deciding to take peptides. Go easy. Until my next video.